practice and asking questions and, um, go from there.
Hmm.
And a little bit background, I'm a family medicine physician right now in America. I also work as a hospitalist in the hospital setting. So I'm familiar with both inpatient and outpatient common things that we deal with every single day. In Vietnam, I think I can be counted as a general practitioner.
Mhm.
Yeah,
Thank you.
that's it.
Thank you. Thank you so much. It's great honor for me to we have a special guest today, huh? And so everyone, please turn on your camera. And by the way, I also want to introduce to you a special guest today, Mr. Khoa, the lecturer from academic, and he's also got the master degree in physiology. Hello, Mr. Khoa, can you say something to our students today?
Hello. Sorry, can you guys see my face? I know I have my camera turned on, but
Yeah, I can see it.
okay, that's good. That's good. Well, hello everyone. My name is Kwa. I got a master's degree in physiology back when I studied in the United States of America. I studied there for 9 years, from 2007 to 2016. And after that, I came back to Vietnam and worked at various jobs, including like various teaching jobs, until I landed a job right now at Hong Bang International University, teaching anatomy and physiology mostly. But also on the side, I also have a project with this company that is called Academic English. And my company teaches a whole lot of courses on medical terminologies and medical English. It's very, very nice to see you all today. And hopefully I got to see and observe you guys speaking English with each other and learn a whole lot today with Miss Drum and very qualified members of the teaching board. So very nice to see you. I hope you guys all have fun.
Thank you. Thank you so much. Yep, Mr. Khoa. So don't hesitate to give us some constructive feedback about student performance or anything that you can give feedback for them, huh? I really appreciate it.
All right. Thank you very much, Miss Drum. I'll let you guys take it away.
Okay. Thank you. So shall we start right now? Mr. Nguyen. Okay.
Yeah, go ahead and start.
Yeah, okay. So let me share the screen, huh? Okay, so guys, can you see the screen that I'm showing you? Session 2, cough, see that? Okay, if you see the slide that I'm showing you, leave a comment in the chat box to let me know. Okay, can you see that? Okay, you can see the slide. Okay, good job. Thank you. Thank you so much. And yeah, it's time for you to shine, Dr. Nguyen.
So, the main goal today is, to practicing how to be able to, you know, I know everybody know how to take a medical history, but be able to take a medical history in English is another, challenging things. And that's what we're gonna practice today. The main key is I want everyone to be able to at least get some medical history of the basic respiratory disease, be able to give some basic explanation to your patient about, what might going on. You don't have to be correct. It's not testing your medical knowledge. This main goal is to practice English, and finally be able to give some general recommendations, mainly to be, again, practicing your medical terminologies and speaking and communication skills. Okay. Because, to be able to communicate the medical term to the patients in layman term is another stories. Okay. Yeah, we can move on to this slide. I already introduced myself. So I know everybody here is have some kind of general background. So basically, cough, there's multiple reasons why. A person can have cough. Most common is infectious. Viral is usually the most common. So Tara, do you want everybody to practicing saying these words, or what you want to,
Uh, Actually,
me to
they
read it
need
out
to
loud?
practice this the pronunciation of these medical terms. We just like
Oh,
revise
we don't. Okay.
of a big picture about some problem
Okay. So, well, big picture is there's multiple
yeah.
differential diagnosis for
Yeah.
cough. One of them is infectious. Most common is virals. Most common in kids is bronchitis. In the older people is pneumonia. But there's also many infectious out there that we, usually most of the time it's virus. But sometime in older adult with more comorbidity, this can become like bacterials. So we can move on to the next one. Other common, a very kind of uncommon cause of cough is neoplastic. Any kind of people or person or patient that have a history of smoking for a very long time, they are highly suspicious for cancers. And the U.S. guidelines established screening for lung cancers generally in these people populations. Um, Dangerous cause that can cause death is, pulmonary embolism potentially can kill a patient. Pulmonary edema is also another cause, but that's mainly the vascular cause from the heart failures. So people with vascular disease usually will have shortness of breath either when they walk or when they're laying flat. So those are the things, because when they sit down and do nothing, they usually doesn't have short of breath. But when they walk, they trigger, they exert themselves, their oxygen requirement increase, and they start to have some shortness of breath and potentially cough. Asthma is the most common cause too. Some of the most common cause. Asthma basically to me is allergies to the lungs. And, those are the inflammatory with some autoimmune response to it. And then pulmonary fibrosis is very rare. It usually show up in people, working with mostly, pulmonary toxicity substance. Sarcoidosis is an autoimmune disease. I actually just have one patient diagnosed on that, but it's kind of rare. A second most common cause of cough that people see is ACE inhibitor induced cough. Um, it's for people who used to be on, or it can happen anytime, even with people on ACE inhibitor for a very long time, like, lisinopril, losartan is also can cause cough, but they're not ACE inhibitor. There's ARBs, they're the same class, but lisinopril is most common. And usually this cough doesn't have any symptoms and they're non-productive. And, when you stop the medication, they just get better. So next slide. So Socrates is one way that we, in America, we use mnemonic, which is a shorthand for like how to remember things. And Socrates, we use each letter of the Socrates to help us to remember which piece of history that we asked the patient about. I don't use Socrates that much. I use a different one, but it basically is the same thing. It's just a way, it's just a memory tools for you to remember. So the S of Socrates start with sight, you asking them like, where do you feel the cough is coming from? Is this from up here or is this from your lungs? Okay. And then the next word is O is onset, like when did this start? Like how long have you been having this for? Like 3 weeks, 2 weeks, 1 week. Okay. And then the next word C is stand for character. Okay. Yeah, which is like, how is your cough? Can you describe your cough? Some patient will just tell me that they cough, but they don't know like what kind of cough is this like. And so you have to ask the patient to be more specific. Like, tell me about your cough. Like, be more specific. Okay. Have you coughed any out of blood? Because that's also a sign of cancer. The full word is R, which is stand for radiation. Does a cough make your chest hurt, and does the pain go anywhere? Usually radiation, we asking for, like, usually if people have chest pain, like, does the pain going anywhere? So sometimes when they cough, they hurt the chest, and you have to ask them, okay, is this pain right in your chest or does it go anywhere? And then A stands for associated symptoms. Again, beside the cough, do you have any other symptoms like fever, short of breath? Is your voice changes? Are you wheezing at all? Do you have any weight loss, fatigue? Do you have any lung disease or things like that? Okay. Next word is T, time course, which means that is a cough there all the time, or does it come and goes? Have you been experiencing any other repeated episode of cough? Like, do you cough one day and then the other you don't? Things like that. And next word is exacerbating or relieving factors. Does anything make the cough better? Does anything make the cough worse? Does laying down make you cough more? Or, does the cough worse in the morning or at bedtime? Sometime like that too. And then 8 is severities. Usually we don't use it in this case, but it's just how bad it is. Like if you have a patient with pain, you asking them on the scale from 0 to 10, how bad is your pain? Because you kind of want to know. Okay. Well, so do we start with the case right now, or because I think this is
Yeah, so I think you should talk a little bit about the past medical history and then
yes.
vitamin C.
I think the slide was a little bit misreading. Okay, well, also it's important to ask about patient medical background too. Does a patient have any medical history? Like, do they have heart failure? Do they have any lung disease like COPD or asthma? Because if they do, you pretty much kind of suspected that may be the potential cause of cough. The other thing is you ask them, do they have any reflux? Because sometimes reflux, gastric reflux can cause cough. And that's a pretty bad one too. Does they have any surgery in the past? You want to know that too, because if there's any previous surgery or damage to, chest surgery, especially, can cause cough. And you might want to know what kind of operation it is and why it was performed. And then did they try any medication, including over the counter? OTC stands for over the counter. Sometimes they have some home remedies as well. You might want to ask them, did they try any like home remedies, like honeys? Some people try syrups and things like that. Okay. And then if they take any medication, like, lisinopril, you're asking them, have you noticing any side effects from the lisinopril that you're taking? Have you tried stopping it? Or, things like that. Those are very common. And then you want to know about their family history too. Do they have any family history of any cardiovascular disease, any autoimmune disease, any lung disease, like alpha-1 antitrypsins? This is kind of rare cause, but some are genetics. Do they have any liver disease? Do they have any, coronary artery disease? And if they say that they do, you ask them what it is. Like, my dad had coronary artery disease. Okay, you ask them how bad it is. Does he need a stent? My dad have COPD. Okay, how bad it is? Does he need an inhaler? Okay, these are just some common questions that you ask. Usually, you start with, "Do you know if you have any family history?" Okay, and then I start asking them like, "Yes, I have family history." Okay, well, who in your family actually have what? In the practice setting, in the medical clinical setting, I don't really use the first, I don't really ask them more specific. I just ask them if they know, they tell me. Usually they know, and if they don't tell me. But sometimes it's more relevant to ask specific, like, beside cardiovascular disease, you ask them specifically, like, does you have any family history of heart failure or coronary artery disease? Okay. Social history is also important, especially smoking. You want to know how long they smoke and how many years they've been smoked. Usually in America, we count them in packs. I think a pack is about 10 cigarettes. So we count them how many packs they smoked, and then we calculate pack years. So that's just something on the side. Um, their occupation is also important. Are they working with animals that can cause allergies? Are they working in, environment that are highly exposure to dust, pollen? If they're working in old houses, they may be exposed to asbestos. That's a common cause of mesothelioma, which is a kind of lung cancers. Are they working in the hospital? That can expose them to infectious disease. Are they working in jail? That expose them to tuberculosis. Okay, things like that. And are they drinking alcohol? You know, and are they allergic to anything? Those are the common, allergies questions. Diet too is also important. If they have cough, I really ask them about exercise. But sometimes if they cough with exercise, that might be a sign of asthma. All right, we're gonna go into practice, and the key is to not to test your medical knowledge again. It's just trying to be yourself and practicing as much as possible. I think this is a rare opportunity to practice speaking in this environment, and asking as much question as you can. So I will leave this to the TA to take this away and enjoy, and I'll see you back shortly.
Yep, thank you so much. So, everyone, do you have any question for our guest and lecturer today before I assign you into the breakout room with our TA and practice? Any question? So I'm gonna give you 1 minute for you to come up with any question. All right, now let me see. Okay, thank you so much, Miss Phương. All right. How about the others? Any question? So if you don't have any question, try to give it maybe the word like, okay, yeah, that's fine, go ahead, or anything like in the comment to let me know that you're fine with that. Okay, and during this time, I also assign the TA and our student into 4 groups. Okay. Right. Let me see. It takes short time for me to assign you into a group, so give me a second. Thank you so much.
Yeah.
Thank you so much.
No
Yes.
worries. One tip for you guys is don't be nervous. Just
Don't be nervous.
try to practice, and you can do what I know most of you are physicians with background, so you can use whatever that you already know about cough, and just trying to think about how to communicate with the patients. The key
Oh.
is communications. Yeah. And
All
don't be
right.
nervous.
Thank you. Yes, I agree with you. So the key point here is try to practice speaking, and especially I hope that you can speak with a full sentence and question. So try to use this opportunity to practice speaking with our TA. So right now I have 4 rooms. In room 1, TA is Mr. Ong. Room 2, I'm the TA. And room 3, you're gonna meet Miss Đan Anh. And room 4, you're gonna meet Miss Phương. So when you join the breakout room, try to remember the name of your TA, Miss Phương or Miss Đan Anh, Miss Trâm or Mr. Ong. So if there is any problem with your internet connection or technical problem, so when you come back, I can assign you to the correct breakout room with your TA. Is that clear? And with our guest today, Mr. Leon and Mr. Khoa, huh? So it's up to you. You can stay in the main room and you're gonna have a conversation together, or you can go around 4 rooms and observe the activities in 4 rooms. So it's up to you, and just let me know and I can assign you into the room that you want. That's it.
It's okay, I'll stay around.
So you want to
People
stay
will be
around?
nervous if I come into the room.
Uh-huh.
I'll stay out.
Okay. All right. Let me open the room first. So you're gonna have about 25 minutes. Okay, 25 minutes for this activity, huh? Okay. Remember your TA. Uh-huh. Remember your TA. Okay, now let's go open all rooms. So we have Miss Hannah. Where is Miss Hannah? Inside your room 2. In room 1. Okay. Okay, yeah. Let me do it. All right. So we have Mr. Clark move to room 1. Uh-huh. Okay. All right. So we have Miss Lin. Miss Room, you're in room 4. Okay. Wait. Now let me see.
Good job.
Oh,
Oh, we're the first.
yeah,
Phương, Phương phải không em?
yeah, dạ vâng.
Yeah. You speak very good English. I hear some French in it.
Yeah, recently got met with my French.
Good job, everyone. I think everyone did really well. I do want to applaud everybody for at least, get out of your comfort zone and asking questions. And I know Phil give you a little bit hard time, but everybody pushed through it. So that's great. That's awesome. I'm proud of you guys. I think one of the tips that I want to give for just my group is, when you speak English, it's important to speak slowly and don't try to pronounce words too fast, because if you do, the words can stick together. Okay, so just a little tips, but good job.
Okay. Yep. So right now, Mr. Leon, you can continue, huh? But
Oh, we're
yeah,
done. Okay,
yeah, we did. But anyone,
so
do you have
can
enough?
anyone can anyone volunteer telling me about a case? Just treat me as you're attending.
All right, raise your hand, everyone. Volunteer.
Oh, and I
Summarize.
want the case summary is like this. This is the how many years old male with certain medical history present for the cough. His symptoms, blah blah blah. Like how you present to your attending in the hospital. Because I know nothing about this patient. Okay.
Okay, so for those who don't know, you can click on the icon raise hand when you okay, where is it? Where is the icon of raise hand?
In React, you can see in React. And you
React.
click on React. Yeah.
Okay. So if you don't raise your hand, I'm gonna call you.
You
Yeah.
just tell me what you know is fine too. You don't have to, be everything. You can just tell me what you know.
Mhm. Okay, so how about Miss Nhung? Can you give me some information that you gathered so far? No worries, you don't need to tell us all information. Just try your best.
Yes, I just hear about some information. My his first name is Johnny and how old 41 years old and he he is coughed 2 weeks ago and symptom fever and he 35 degree a few days he symptom fever a few days ago and he is 35 degree and no disease but he is agree at 11 years old and he test COVID no smoke no allergic and a little alcohol and a little exercise and a doctor prescribed amoxicillin and he is clap and my wife worry and tell him go to the hospital and he is green yeah
Okay, thank you.
Okay,
Okay.
very good. Very good, very good. So from what I hear, this patient is a 41 years old male. From what you present, right? Okay. This patient is a 41 years old male with no past medical history, present to the emergency room with the chief complaint of cough for 2 weeks. Okay. The cough is productive and with fever and short of breath. He was given oral antibiotics in the outpatient, but was not improved. Okay, that's what I got from the sign out. Good job. You'll be able to communicate back to your supervising doctors, what the case is about, and that's important. So, one thing in the medical setting is your supervising doctor don't have a lot of time to hear everything. So you should learn to pick up what is important and then sign out with just a one summary statement about the case. All right. So Tony Rogers, 41. All right. Cough. So what is everybody thinking that this guy have? Do you guys want to go some clinical findings first? Okay. Let's show them some clinical findings. So the patient experienced fever but no weight loss or night sweats. There's some dizziness, but he does not loss of consciousness. LOC stands for loss of consciousness. His ENT findings does not show any ear pains, any sore throats, or problem with swallowing. His cardio finding does not show any palpitation or chest pain. His GI finding does not show any diarrhea, vomiting, or any changes to bowel habit. And he does not have any lower urinary tract symptoms and no change in urinary habits. So before we go into some, labs or, what's as the next step here, anybody want to do anything for this guy? Or what kind of lab you guys want to get, or what is your idea before the labs? I would like to ask, like, anybody have any idea of what's happening to this man? You can raise your hands. You can feel free to type in the chat box if you are introvert. Okay, Miss Lang Hương is raising her hands.
Yeah. With this man, I heard that he has a productive cough with the green, and he not improve after use of 5 days with the antibiotic. So in this time, I will take the CBC and the CRP for him, and the second I will do the X-ray.
Very good, very good. What do you think he have to make those decisions?
Make those decisions.
Yeah, why you decided on the CBC, CRP, and the X-ray? I just curious.
So I think maybe he got a pneumonia
Okay,
or
very good
inflammation.
thought. Okay, good job, good job. Pneumonia is on the differential. All right. I agree with your suggestion. So let's get them the CBC and the CMP. And I just got a call from the lab, and this is your numbers. Okay, so regarding the CBC, I summarize it for you. There's some elevated white blood cell counts. The hemoglobin and the hematocrit seem to be normal, and there's also some neutral fills that is elevated. And I agree with the CRP. Let's just say it's elevated. And okay with the virus rapid testing too. This is the emergency room. You can do that too. Oh, and the CMP shows some hyponatremia. Hey,
Sorry.
Tara, can you? Yep. Hyponatremia, they have a normal liver function, normal kidney functions, normal GFR. Just a little bit low in sodium.
So hyponatremia.
Okay, and your X-ray just come back from the radiologist, and it seemed like can somebody read this X-ray? Oh, since Miss Lang Hương ordered this, can you tell me something about the X-ray that you see?
He got inflammation in the half lower half of the lungs, the left lung, and
Great.
and
Great.
one third lower lung of the right lung I saw.
Awesome. We call that consolidation. Yes. I'm not a radiologist, so of course I can't tell everything about the X-ray, but I can see that there's some consolidation there in the lungs, especially in the left lower area. A little bit of interstitial infiltrated on the right side of the lungs too. But that's pretty much all I see. Compare to the case. Now, do we have the idea of what this man may have? What is your final diagnosis? I know we have a working diagnosis as a pneumonia, but is that your final diagnosis?
Okay, so how about the others?
Yeah,
What-
raise your hands. If
Yeah,
you
raise
are
your hand.
introvert, type in the chat box.
Okay.
So Miss An says pneumonia. Anybody have any other ideas or differentials? You can say anything. This is a chance to practice. You can give me as much differential as you want. CAP, great job. What CP stand for, Mr. Hao?
Yeah,
What does CAP stand for?
Yeah.
C là mu acquired pneumonia.
Great, great. It stands for community acquired pneumonia. Very specific. Thank you so much for your contributions. So there are a few types of pneumonia that if we go into detail, this class may become a pneumonia class. But thank you for that. I really appreciate that. So yeah, the patient likely have pneumonia from all the findings. Now, can anybody explain, what pneumonia is and, in English? Let's just treat me as a patient. I don't know anything about pneumonia. I will ask you, what is pneumonia? What do I have? And you have to tell me like, okay, you have what? And things like that. Like anybody wants to give it a try?
I will try.
Okay, yeah, it's good. Try is good.
I think I will explain to the patient that I think you got a pneumonia. Do you know about this? Do you know about this disease? It means that you got a bacteria from the environment, and when you breathe into your lungs, and they stay there and destroy your lung and make the inflammation, and now you got the pneumonia. And I think maybe you get a severe bacteria, so it make you cough for 2 weeks, and you don't feel better.
Okay,
So we
so I
will.
have a bacteria infection in my lungs. Is that what you say, doctor? Okay, well, what should I do about it then? Because, now this is my first time getting it. I don't know what to do. And I try antibiotic with my doctors, already, but I don't feel better. So what should I do? doctor?
The first I will check again to make a lab test to know clearly about your inflammation, and maybe I will do some endoscope to find out and to find out the exact name of your bacteria, and in the time to wait the answer from the lab, I will give you prescribe for you an antibiotic and something, and you will come back to 1 week to see me again.
Okay. What if I don't get better with the antibiotics? What is your next steps? Like, I feel scared because I tried the antibiotic already for 5 days, but I don't feel better.
Sorry to interrupt you, but is it okay if we move on to another student so they also have
Oh,
time?
yeah.
Yeah, but you
Everyone
did a
feel
very
free to
good
raise
job
your
listening.
hands up.
Yeah,
Good
very
job,
good.
Mr. Sorry, I got too carried away.
Sorry about that.
Um,
Great. Yep.
So this next part is just, giving an explanation to the patient. What is pneumonia? What is your plan in general? You give them a general advice, which Mr. did a really good job. And then I kind of quizzing her a little bit more on, the prognosis, like what happened if the antibiotic doesn't work. And then you give the patient some time for questions, which she already did it as well. Very good. The key part is you all know what is the disease, but the patient doesn't know. So we have to say it in the very simple term for them sometimes. I think the next slide just gives some ideas. But is anyone want to, give it a try again? I'm willing to be their patients too. Just this is a good time to practice. So if no one raised their hand, for me, if I'm a doctor in the emergency room, seeing this patient, I will tell them that, hey, you're having an infection that, making you cough. Infection means that something, foreign from outside your body is attacking your lungs. And yeah, and then, the management plan is since you already failed the oral antibiotics, I'm going to call the hospitalist to admit you to the hospital. Because I think if you already fail antibiotics in the outpatient setting, you should come to the hospital to get some IV antibiotics. Okay, and I'm also worried about you having sepsis because of, sepsis mean that you may develop a worsening infection in the blood, given your blood count, your fevers. I just want to monitor you a little bit more closely in the next few days. So that's why I'm admitting you to the hospital. Okay, and then the general advice is it should also be important that you should consider, stopping smoking, because if you smoke, it's just make everything worse, and you likely more having worsening pneumonia in the future. Prognosis, usually we give them a general ideas, given your standards, given this infection, we likely see improvements in a few days, but we also want to monitor to see if we treat the correct, organism to make sure. That's why you should come into the hospital. Okay, that just reinforce your ideas of you can admit this patient to the hospital. Okay, and then question time is you just ask them, do you have any question for me about the plan? Okay.
Dr. Leung, is that good for a patient when you get a severe cough and you advise that they still keep the exercise? For example, if they like to swimming or with the heavy exercise, it's good for them.
Yeah, new research come out that's saying exercise pretty much good for everything. So they should not stop what they doing, but you advise them, hey, you exercise, you can tolerate. Don't go like right after you recover, don't go ahead and climb a mountain or something. just advise them exercise as you can tolerate. Okay.
Okay.
But if they have cough with exercise, even after you treat the infection, you might want them to get like at least some kind of baseline lung function test, because they may have underlying lung disease. Sometimes people after the bad infections, like, COVID, they develop, worsening worsening lung disease. Because we know COVID causing inflammation in the lungs, which can result in interstitial lung disease. So their lung function might drop. But that is, not the scope of this case, but, you should refer them to a pulmonologist after, if they treat everything infection-wise, they recover, but they still having cough for a long time, you refer them to a lung doctor so they can test you do the pulmonary function test and, try other testing to see is they having an underlying lung disease that we need to know about. Okay, does that answer your question? Okay, I think the next thing is oh yeah, sorry, questions.
Oh, because maybe I can give them a deep breath exercise like in the COVID. Maybe they can improve
Oh
their
yeah, and
lung function.
breathing exercise are great. I love it. Great idea. Okay, give them a little breathing things. That will help too. I think the next part is Tyra will break you into a small break room so you can explain this to your patients. And now that you have your findings, okay. I will be into one of the random room. So if you see me, don't be alarmed.
Okay. Thank you so much, Dr. Nguyen, and thank you for your very nice question, Miss Hương. I love it. So right now, I'm gonna assign you into the breakout room again. And what you wanna do right now is try to give the explanation. What is pneumonia, management plan, giving advice, prognosis, and question time, like as you can see in the slide here. So it depends on your current English level. Our TA can let you freely give explanation, or you just need to read out loud so that our TA can correct your pronunciation. It depends on the decision of our TA, huh? So any question for Dr. Nguyen and our TA before we start giving explanation? Okay. So how about Mr. Khoa? Do you want to join a different room?
Sorry. Yes, please. I would love to join a room as well. Hopefully, like, maybe a different group than the previous one that I was in. So
Okay.
thank you.
Okay, sure. Thank you. Okay. All right, give me a second. So let me move Mr. Khoa to room, which room? Okay, room 3, huh? Okay. And how about Mr. Nguyen? You can join room 2.
Just give me a random room. I like randoms.
Random.
Yeah.
Okay.
Random like gambling.
I love gambling. Okay, everyone, can you join the room right now? So, Miss Khánh An, who is your TA? Miss Khánh An, who is your TA?
I don't remember last time. Maybe Miss Lang.
Miss Đan Anh.
Lang Anh, yes.
Đan Anh or Phương Phan à?
I remember that Lang Anh.
Okay. Yeah, nice. How about and Miss Jang, you are in room 1, right? Ah, no, you're in. Okay.
Oh, we're the first to come back.
Yeah. So actually, right now, we maybe spend 5 minutes for everyone to give any like feedback,
Question.
feeling, yeah, question, and also reflection, what they have learned so far and things like that.
Awesome. Yeah,
Mhm.
it was very fun. Thank you for inviting me, though.
It's my pleasure.
I like to be a patient next time. It's kind of
Oh,
fun.
wow. I appreciate that. So you can be the patient next time.
Everybody will have like a hard time.
So I can send you the Zoom link for the next time. And if you are free, yeah, just join with
Yeah.
us. Mhm.
Oh man, I like to
Oh,
be a patient already.
you love to be the patient.
Yeah. No, I mean coughing still, doctors.
You cough a lot. You know what,
Sorry,
Dr.
I
Leon,
choke on my coffee, so that's why I cough.
Dr. Leon today, he is the simulated patient in our group, and he coughs a lot. He
I
coughs a
think
lot.
maybe
Supposed to
he
cough,
will be
right?
a good real patient for us. Socrates.
Oh, I was like coughing. Doctor, please help. Well, you need to make it more realistic.
Yeah, yeah. But this is also the skill of simulated patients, right?
Yeah, I used to do simulation patient before. You know, I
Wow.
trained medical students and
Oh,
simulation at the medical school here. So, yeah, so I have a lot of fun time, you know, testing my patients, testing my students,
yeah, I love.
emergency skills.
So now it's time for you guys. So we just spend 3 to 5 more minutes so that you can have any question, share your feeling, and what have you learned so far? Just feel free to tell, just feel free to share with us. Some students are quiet. So I just want to pick up someone to
I
say
told you they
something.
are introvert.
Introvert. Yeah, maybe.
So I want to give like a quick 1 minute, you know, feedback for everyone. Everyone do a good job today. I might not be in your room, but I was in some, and I kind of saw how you interact with the TA and the simulation patient, especially with me when I a patient. And you guys did a very good job at explaining. Your again, it's not a medical knowledge that we're testing you on. There's, everybody can have different way of managing pneumonia. No comments on that. But it's important to practicing your English. You all know how to treat the patient. It's just to put it into words and explain to the patient in their own languages that, you know, is important. And everybody seemed to do a very good of that. One advice is do not try to speak English so fast that, you know, the patient cannot hear what's going on, because as a human being, we tend to get nervous, and when we get nervous, we speak fast. And when you do that, you know, your English word will be clumped together, and it's very hard to tell what's. Um, um, I can hear it. My TA cannot. I can hear what you're saying despite how fast you talk, but my TA have a hard time on listening to some. But you know, that's a good practice. It's good to practice.
Thank you.
Okay, but everyone's doing great. Now is your time for questions.
Yeah.
Dr. Leon, can you show us about another method you asked detecting history? Because in the first you tell that you don't follow to the Socrates.
Yes, I use something called OPPQRST. That's just, you know, something that I used back in medical school till now. You can pretty much Google what that is, but technically it's the same thing. O stand for onset, P stand for, you know what the pain level, or you know what make it better. The two P's, what make it better, what make it worse, provocation and palliative, and then Q stand for quality, R stand for radiation, S stand for severity, and T stand for timing. So I use OPPQRST. So it's the same thing as OCART or Socrates. It's just the memory tool to help you take history better, especially when you learn medical school here. That's what they teach you, is how to take medical history, and that's what we're practicing on. We can just pick one. Everything come to the same information.
Yeah.
And as you get more experience, you tend to forget these things. But this is the basic, and always stick with the basic. So that's what I use. Tyra put in OCART, which is the same thing. It's just a memory tool to remind yourself of, if you forgot what to ask.
Yes, thank you. I will search for Google.
So it depends on you, whatever you like. But if you
Yeah.
just follow just one only.
Yeah, just pick the one that you easier to remember, because
Mhm.
the memory tool is important if you remember what it is. It will be a burden if you don't remember what the memory tool is.
Okay, good question. Thank you.
Very good question. Thank
Yeah.
you.
How about the others?
Again, if you're introvert, you can type in the chat.
So maybe just maybe 2 more minutes, huh? I think it's quite late.
Yeah, it's only 6 a.m. over here, so I'm just starting my day.
Oh, I see.
Not really late, it's very early, but
Mm.
I used to work at 5 a.m. anyway, so.
We are very appreciate because you get up very early.
No, it's just my regular get up time, because I work in the hospital. I used to deliver babies, so it's around this time is when I start my day.
Mhm.
So that's why you have a blanket under your eye.
Yes. Yeah. Need to
She
see a
is a
dermatologist.
dermatologist or team.
Yeah, anyone here is a dermatologist? Maybe you can give me some idea.
Yeah, that's the one who asked you. She is the dermatologist.
Oh, she's a dermatologist?
Yeah,
Okay.
so that
Yeah.
she just
We may connect later.
So
Oh, yeah.
I have some feedback for the students. So please try to speak more, speak
Mhm.
slowly, because some hard work just go with just like immediately. Yeah, just go slowly. Try with that, and try to go with louder. And don't forget about any sounds, because that will help us to know what's in the word. And maybe I think Tara, maybe they need more time to speak because they're just so shy, and even they are the doctor, but they so shy, so they don't know how to deal with that. And I know that we are on doctor, we are on graduate from the hard exam before we could graduate to be a doctor, so we know how to ask the patient. So please more courage. Yeah, just step it out and ask, as usually do in Vietnamese, but just now translate in English. The first time is very hard, and we couldn't pronounce it the right way, couldn't use the right vocab, but just use with the simple term. Yeah,
Simple
deal with
term.
it.
Okay.
Yeah, the things is you know how what to ask. Yeah,
Okay.
deal with it. Yeah.
Yeah. On top of that advice, always use a simple word, exactly what he say, exactly what Ân say. We all know how to ask history. We all doctors. If you ask the history in Vietnamese, you probably easily done that. But in English, if you don't know the medical term, just use the most simplest term that you know. And that's the easiest way. Because I never ask my patient using medical term either.
Yeah. So yeah, guys, that's great. That's great. So how about I just want to ask our guest, Mr. Khoa, how about you? Any feedback for us or anything to share with us before we leave?
Well, yes. So thank you very much, Tyra, for inviting me here today. And I just want to say that, I think I think like, the shyness is probably due to you not being able to practice a lot, especially not with like, an environment. But I think it is very, very important. Just like, I shared with the first group that I had the opportunity to observe today, is that like, you guys do need to practice these sentences, the mock questions. They don't have to be the questions that you guys receive from here, but can be questions that you generate yourselves based on your own words and own terms at home based on this framework. And I think it is important to practice these at home first before you actually had a chance to interact with like, another person, even if it is only like, a mock patient, so that you build up your confidence, you build up your tongue, your muscles to be able to speak these terms and these questions to the best of your abilities. And then after that, with all of these practice, then later on, you will be much more confident when you're faced with a real patient. So yes, that's my general advice for everybody. And you guys all did a good job, just like Dr. Nguyen has said. Thank you.
Okay, thank you. Thank you so much, everyone. Yeah. So I think it's quite late now. That's why can we finish here? Okay, so if you have any question for us, don't hesitate to raise your question, maybe for me, for any TA that you like to talk to. But once again, thank you so much for our guest today, Mr. Leon Nguyen and Mr. Quang Nguyen, and also all of beloved teacher, all of beloved TA and students. So thank you so much again, and goodbye, and see you next time. See you next
See you
week.
guys next time.
Yeah,
I'll
yeah,
be
see
your
you next
patient next
time.
time.
Yeah, yeah. Oh, I appreciate it.
Okay, see you guys later.
Yeah, see you guys
Bye
later.
bye.
Yeah.
Do you want me to stay or?
No, no. So that's all.
Okay. All right. We'll
Yeah.
see you next time.
Yeah, hope to see you next.
Thank you very much, all of you guys.
All right.
See you
Thank
next.
you guys for coming. I really love it.
And I'm afraid that maybe some doctor don't use English regularly, so they feel shy when talking in this
Yeah.
room. And
No worries. It's take a while for you to get used to this because you can never be too familiar. Even me, I been in English environment for 16 years, and sometimes I still have a hard time talking to patients, especially patients don't speak English too, and then they try to learn English as their second language. That's even harder. So it's a progress, and everybody is doing good job. I think as long as you're willing to try, you can pretty much do it. It's not. It's a skill, and skill come with training. So.
Yeah. Ok, thôi dạ rồi thôi để Cúc
Okay.
Nè nói tiếng Việt nha.
Thôi nói tiếng Việt cũng được.
Dạ thôi để Cúc Nè em nói tiếng Việt nhanh ha. Là mọi người cố gắng giúp em là cái phần làm bài tập á. Nếu mà mọi người delay á, mà mọi người thông báo sớm thì tụi em sẽ dời lịch lại cho mọi người, nhưng mà mọi người chỉ delay maximum là 3 lần thôi nha. Còn mọi người mà delay nhiều hơn 3 lần á, tại vì việc mà mọi người delay nó cũng sẽ ảnh hưởng đến lịch trình của TA và chúng em. Cho nên là thôi cho 3 lần nha. Delay 3 lần là tối đa nha. Dạ rồi. Với lại là hôm nay cũng có một số anh chị hơi quiet thì ok không sao, những lần sau mình cứ cố gắng mình nói nhiều hơn, mình tập nói ha. Thì ở đây thì bác sĩ Lê Nguyễn cũng chắc là tuần sau anh cho rồi đúng không? Em sẽ gửi link lại cho anh ha. Dạ em sẽ nhắc nhẹ.
Tuần sau là cái bài gì?
Dạ John Penn đúng không?
Tuần sau nữa chứ.
Tuần sau nữa chứ.
Vậy-
Anh đâu có nhớ John Penn.
tuần sau nữa. Dạ nghỉ lễ quên.
Ok.
Dạ John Penn. Dạ không.
Ok.
Dạ anh đừng lo, có gì em sẽ nhắn
Có gì
chat.
thì báo anh chứ anh chả nhớ gì nên mà anh lớn
Trời ơi.
anh dạo này trí nhớ anh kém lắm.
Anh còn
Anh
không nhớ
còn nhớ gì xảy ra ngày hôm qua nữa mà.
Dạ rồi.
ok.
Ok
Cảm ơn
thôi mọi
mọi
người
người.
ha, cũng khá là
Giờ
trễ.
này ở Sài Gòn là đang rất là nhộn nhịp bởi vì chuẩn bị cho Independence Day.
Đây chị thấy chưa đu concert này.
Cái gì vậy? Thôi
Concert.
mọi người đi coi diễu hành vui vẻ.
Dạ.
Chứ mà tối thứ bảy mà tối chủ nhật mà ở nhà thì buồn.
Dạ. Rồi
Okay,
thôi.
see
Tạm biệt
you
mọi người
later.
ha.
everyone.
See ya.
Bye.
You.
See you.